A young Central Texas nurse and mother is sharing their battle with breast cancer. She was diagnosed last year in her 30s with no family history of the disease. CBS Austin's Melanie Torrey spoke with her about her message for other women.
Amy Woods is a mom, wife, and nurse at St. David's Georgetown Hospital, and she's had a whirlwind of a year. After finding a lump in her breast, she assumed it probably had to do with breastfeeding. She mentioned it to her doctor, who wasn't worried, but she and her husband didn't let it go.
My doctor decided that he would order an ultrasound just to clear the air.
She says it was awkward taking things a step further since she was young and breast cancer wasn't in her family history.
Went to the appointment. They're like, why is she here for a mammogram? You know, we don't do it on women who are 36 years old.
But days later, her worry became reality. Woods was diagnosed with triple-negative breast cancer.
It was kind of a gnarly form of cancer, and that I would have to lose my hair, go through 20 weeks of chemotherapy, and then decide to have surgery.
This type of cancer tends to be a more aggressive cancer.
Dr. Bridget O'Brien is a breast surgical oncologist at the same hospital where Woods works. She says doctors are making great strides in treating these diagnoses.
I'm really excited about the research that we've done in the last several years for breast cancer. It has allowed us to do less invasive surgery and have better outcomes.
Woods opted for multiple surgeries, including a double mastectomy and reconstruction. Procedures briefly delayed by COVID-19 surgery restrictions.
At the time, it was like my whole world was coming crashing down, you know.
Dr. O'Brien says people should remember breast cancer is sporadic, and often patients like Woods have no family history of the disease.
Please do your due diligence and checking every month to make sure nothing's changed, and also paying attention to the skin and the nipple to ensure that there are no changes there either.
As far as they're concerned, Woods' cancer is gone, but she knows it could come back. Calling herself a realist and an optimist, she's focusing on her family, husband Ben and sons Holden and Tate, who give her drive to survive. Her advice to other women, especially young women:
don't be scared to look into things that you're concerned about, and don't let anyone downplay those concerns.
Melanie Torrey, CBS Austin News.